And let us look here in the slide. And so if we just move on, you can see there is information about the meaning of the phrase that we've already used. So this is presenting complaint, which stands for just the abbreviation is PC. Presenting complaint is the term that is used mostly in Europe and in Canada. And the Americans use a chief complaint instead of this. So you should understand that this is one and the same thing. And so as you remember, this is the initial concern which brings a patient to a doctor, the reason for which a patient approaches the doctor. And the doctor asks questions about so these reasons. And so the doctor should ask questions to clear out the condition of the patient. So, and doctors use Socrates model in the history of the presenting complaint to help them remember the main questions that they need to ask about pain. So if you keep in mind that you should follow this model, so you shouldn't miss any important information, any important question. So you can see here on this slide, so that Socrates goes across town, and each letter of this word Socrates stands for a separate word, just a step in the conversation about pain. So S stands for site. It means the location of pain. So O for answer, the beginning of pain. C for character. So if the pain dull, sharp, the character of pain. Then R stands for radiation, or whether the pain goes to other parts of the body, radiates to other parts of the body. Associations, this is about what other conditions are associated with the pain. Timing is for how long the pain lasts. Exacerbating and alleviating factors. Exacerbating means what makes pain worse, and alleviating what makes it just less severe. And severity is about how strong the pain is. So this is the Socrates model, just to help doctors to ask correct questions. And what are the questions that the doctor asks about pain? So about each of the steps here in this model, what are the questions? Yes, guys, any ideas about the site, for example?
It's like where's the place of the pain?
Exactly. Yes, the other questions about the other steps.
Maybe on timing. Oh, sorry.
Okay. About the character.
Maybe when and where it started. When
yes.
It started.
Yes, this is about the site and the onset. And what about the character of pain? What is the question? So?
Can you please describe the pain?
Exactly, yes, right. The other questions, please. Okay, actually, so let us just look at them. Here they are. So you can see, so about the site, where exactly is the pain? Then the onset, when did it start? And look, was it constant, intermittent, gradual, or sudden? So if we ask, was the pain sudden or was the pain gradual? It's also about onset. Well, and the character, what is the pain like? Sharp, burning, tight? So you remember that we've discussed several more adjectives, just how to describe the character of pain. You may ask them, use them in the question. About radiation, does it radiate or move anywhere to the back, for example? Associations, is there anything else associated with the pain, for example, sweating or vomiting? So, and about timing, does it follow any time pattern? How long did it last? It's not about the beginning of pain, but just the time it lasts. And so exacerbating and elevating factors, does anything make it better or worse? And severity, how severe is the pain? Consider using the 1 to 10 scale. This is also a good idea, just to use the scale. Well, this is how the Socrates model just looks like, and let us have a look how it works. We are going to listen to Dr. Martin and Mr. Wood, his patient. And you can see here in the picture that Dr. Martin is examining his patient. He is listening to his lungs or his heart. And just before we start listening to them, let us focus on some, on this slide, there are some abbreviations here to the left. And our task is to decide what the abbreviations stand for. So let us listen to, let us listen to Aisha, the first abbreviation. What do you think it means? Aisha, hello?
Doctor, you mean the picture or the question?
So the first abbreviation number, it's not abbreviation. Yes, it is like, because it's not the full phrase. What does it mean? Pulse, 100 min. What is it about? Yes,
About,
who can help us? What does it mean, 100 min? So, any ideas?
pressure.
This is how, this is about the beating of, the beats of pulse. Yes, so
Pulse rate, yeah.
Yes, the pulse rate, you're right. This is 100 just beats per minute. This is the meaning. What about number 2? So what does it mean? And let us listen to Ramil.
So teacher, I think it's blood pressure.
Exactly. And the other letters, mm.
Wait, millimeters.
Yes, millimeters of mercury. Mercury, because mercury just was commonly used in this kind of devices. Okay. Yeah. So the next line is for Abdelrahman. Abdelrahman.
Yes, miss.
So
it's jugular venous pulse.
Jugular venous pressure, actually, yeah.
Pressure.
So it's
pressure,
not.
Yes, so.
It says that it is not elevated. Good, thank you. And Yana, number 4, please.
CVS NAD. So CVS NAD, I guess this is.
So actually, this is a part of the body. It stands for the name of some system.
The cardiovascular system.
Exactly. And NAD stands for no.
I guess I know.
Yes.
Is it the
When doctors describe the condition of, for example, the cardiovascular system, so they just mark that here, no abnormality detected. These are the, this is the meaning of this phrase, no abnormality detected. Okay, so, so Yosif, please, the next number 5. These letters, what do they mean? Yosif?
OE.
OE. So once we've met this, okay, actually this is on examination. So then there is widespread early inspiratory fine crepitations. So crepitations, some kind of sounds in the lungs. And number 7 is audible. What does it mean, audible? Afs, can you explain it? Afs, are you here?
Yes.
Okay. Any ideas about audible? If, for example, like here in the picture, the doctor just listens to.
Like hearing?
Yes, so it means that the doctor can hear some
we can
sounds
hear?
in his lungs, for example. Okay. So the number 8 abdomen is normal, and the last line here, CNS, NAD, CNS. What is the meaning?
They control neural system.
This is the central nervous system.
Central nervous
Yeah.
system.
Nervous system.
Yes. No.
And abnormality detected.
No abnormality detected. Okay. So actually, so the meanings are given here on this slide. And for example, crepitation. So it was like widespread early inspiratory fine crepitations. Crepitation here, a peculiar cracking, crinky, or grating sound around the lungs. So doctors use a lot of abbreviations, acronyms, and so we should be able to understand them. But actually, maybe they are not the same in different countries. Well, and now it's now when we are moving to the listening stage, and let's listen to part of a conversation between Dr. Martin and Dr. in A&D and Mr. Wood. As you listen, make your own notes about Mr. Wood's presenting complaint. So you should just have a paper and make your notes what you do understand. You remember that A&D stands for accident and emergency. Now I'm going to turn it on, and you should tell me if you can hear or not.
Listening 3. Listening 3.
Can you hear?
Yes, doctor.
Okay. Now, please.
Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No. I haven't brought anything up.
Okay. I'd like to ask you some questions.
Well, so now, what do you understand from the conversation about Mr. Wood's condition?
He have
Started
chest
from the
pain
chest.
Okay, tightness in his chest.
and cutting
before
or
it's-
hair.
Yes. Your name. You started. Your name is Nur. Yes.
Yes,
Yes.
doctor. My name is Noor.
No. So we continue, please. What you do understand from the conversation?
Okay, he was making anything from the garden, and before 2 weeks he started the pain from his shoulders, and now he come to his chest, and he feel that anyone squeeze his chest.
Like he feels like someone was squeezing his chest.
Yes, yes.
Okay. So yes, Ramil, just would like to say something. Ramil, you
Yeah.
raised your hand.
Teacher, so he had a chest pain and he also had a shortness of breath. He couldn't breathe properly. That's why
Okay.
doctor first gave him a painkiller, a medicine.
Exactly.
That's why they started the conversation. And we understood that pain in the center of the chest, and it has been going from like an hour. But before it started 2 weeks ago in the garden, and from his left shoulder, we paused it and moved to center of the chest.
Yes, right. Now, just sometimes we have problems with understanding all the details. And I would like you to listen for the second time, and like this is the way that can help us in any listening. If you've got the recording and the script, for example. Now you can see the script on this slide to the conversation. Now we are going for the second time, and you will compare what you understand from the first listening with the maybe you compare how much you can understand and clear out some details of the conversation. Let's listen for the second time, and then we will add the information. We will share what we do understand now.
Listening 3.
Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest,
Right, I see. And how long have you had it?
for the past hour.
The past hour. And is the pain constant?
Yes, at the moment it's there all the time.
And does it go anywhere else?
At the moment it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No, I haven't brought anything up.
Okay. I'd like to ask you some questions.
Now, when we can see the script and just follow listening with the script. So have we learned more about the conversation? Did the script help? What do you think about? What do you think of it? Yes, Ramin?
Yes, teacher. So we learned that, wait, where is it? Yeah. We learned that she is actually a bus driver.
You didn't understand this from the first listening, right?
Yes, teacher.
I see.
And when this pain first came, this patient thought it was a touch of arthritis.
Yes, yes. Sometimes it's not easy to understand how some medical terms, right?
Yeah.
I see. Well, okay. And so if we
Listening 3.
have a look at the next slide, the first question is about what does Mr. Wood do? You already answered this. He's a bus driver. So rather just hard job, especially when he gets up early in the morning on a frosty morning, as he says. So the question is, does Mr. Martin follow Socrates model? Abdul Rahman, can you answer this question? Abdul Rahman, hello?
Yes, miss.
Does Dr. Martin?
What's the question?
So the second line here, does Dr. Martin follow Socrates model?
Can I answer it?
Yes, he does, miss. Because
Yes.
when he asks him a question, it stimulates his critical thinking and gives some ideas of how the pain started and when it started, and reasons of why it may have started.
About radiation of pain also, yes?
Yes.
Okay. The next question is for Yana, please.
What is the correct diagnosis for the shoulder pain? It was like the sick at all. I think the correct diagnosis for the shoulder, you mean the questions that he
it's not the shoulder pain, the pain in the chest. Shoulder pain, sorry, yeah. Shoulder pain.
Yeah, the shoulder pain.
This is what? What is it?
You mean the question that the doctor
No. So what do you think about the correct diagnosis for the shoulder pain?
And so diagnosis for the shoulder pain.
Actually, he mentioned this diagnosis for shoulder pain. What was it?
Okay, maybe how is your shoulder, like physical exams to check for any structural problems, and
Okay, Suat, what is your diagnosis? Suat,
Maybe arthritis.
will you speak louder?
Arthritis.
Arthritis, yes, arthritis. So you see, so in the text here, so Mr. Wood says, I thought it was a touch of arthritis, okay? And what is, and this is, but it wasn't arthritis. What was the real diagnosis? I mean, for the everything, the shoulder pain, the chest pain. So what is the diagnosis for this patient? Doctors. So the chest pain, the short of breathness, the pain that irradiates to the shoulder, to the left shoulder, I guess. So what?
Maybe angina pectoris.
Exactly, yes. So the problem with the heart, angina pectoris. Okay. And what is the immediate treatment for this disease, angina pectoris? Immediate treatment.
Take medicine, rest eyes over the continuer, take anti-inflammatory medicine.
What kind of medications should you give to this patient? So you remember at the beginning of the conversation, the doctor just offers the patient some medications. What kind of medications?
Yes, teacher. Painkiller.
Painkillers, yeah. And just the immediate treatment for this kind of problem with the heart is just aspirin, just for the patient. Okay. Now let us just focus on the following slide. Here there is information about grammar, how we should use the tenses, different kind of grammar tenses in presenting complaint. So understanding the time that patients are referring to when they speak is crucial to making a correct diagnosis. And when they describe their current condition, they can use several grammar tenses like present simple, present continuous, present perfect, or present perfect continuous. And there is the difference in the actions that are described with the help of these tenses. Let us focus what we do remember about these tenses. What kind of action can be described with the help of the present simple tense? Yosif, can you answer this question? Yosif, are you here?
Yes, doctor. Can you repeat the question, please?
What action is described with the help of present simple? What's the meaning of the present simple tense? So Yana knows it. Yes, Yana, help us, please.
General facts, such as the sun rises every day. This is a general fact.
Exactly.
And yes, and when an action is happening right now, I would select happening regular, just suggest the same as I mentioned. Yeah, and what else?
Yes, what else? So
It's like
Nur.
present thing.
Nur, what else?
Okay, the present continuous is
Okay.
action or condition that's happening now, and it may continue into the futures, and its formula to be I am, is, are, plus verb, plus present particles.
The verb form with ing, right?
Yes, yes.
Okay, good. Thank you. So the present perfect tense. What's the meaning of the present perfect tense? What kind of action can we describe with the present perfect tense?
Can I, doctor?
Your name?
Aus.
House, please.
Aus. It's an action or a state that either occurred at an indefinite time in the past.
Yeah.
And the form is have, has, plus the past participle.
Exactly. You're right. And so just Jana would like to add something.
To present perfect or
Perfect.
continuous.
So
So the present perfect is often used when in an action that starts at some point at the past and is still continuous or until right now. Like
the perfectness is just okay. So Aisha, what would you like to add?
Miss, I want to talk about the present perfect continuous. It's
Okay.
used refer to unspecified time between before, now, and now. The speaker is talking about the something that started but preface did not finish in that period of time. Like we said, we have been singing or we have been swimming, like that.
Exactly. Okay. So actually, so you know a lot about the tenses. There won't be a problem in understanding the difference in the use of these tenses. Just I would like to say, just summarize the information about the present simple. Here the information is given, and so this tense is used to talk about like something that is true at the moment of speaking. For example, I feel better. This is the condition that a patient describes. Then something that is happening on a regular basis around now, like in the example, I get these headaches in the morning. It means every morning on a regular basis. They repeat every morning. And a condition like here, when I lean forward, the pain goes away. The pain starts in my chest and moves up to my shoulder. This is also the condition that a patient can describe. As for the present continuous, so by the way, or when we speak about the third person singular, we should add s. Pain goes or pain starts and moves. We add s at the end of the verb. You remember this. And the present continuous tense is used to talk about something that is happening at the moment of speaking. Example, his blood pressure is rising. Is rising. Present continuous consists of two parts. Or I'm having difficulty breathing, am having. So then something that is happening around now, though not necessarily at the moment of speaking. Example, are you taking any medication? It's not about now at the moment, but this week, for example, are taking. And I'm having chest pains. I'm having chest pains, for example, for 2 days, just then something that has been arranged for a date in the near future. So this is one more function. I'm seeing a psychotherapist next Wednesday, so I have the arrangement next Wednesday, and this will happen for sure, 100%. I will meet the psychotherapist. So to show this, to express this idea the present continuous can be also used. And we should so remember about the fact that some verbs are not used in the continuous form. For example, the use of have, the verb have in the present continuous to refer the moment of speaking is more limited than in the present simple. It means we should use most of the verbs have in the present simple. It is generally restricted to expressions such as have difficulty doing something, have something to eat, or have a shower. We can use have with this meaning in the present continuous form. For example, he's having difficulty speaking English, or so we are having something to eat now, or I'm having a shower, I can't just answer the phone, and so on. Well, yes. So I see that we have less than 1 minute. That is why just we need to pause the class. Now, see you in 10 minutes, okay?
Okay, teacher.